So the average sexual cycle lasts about 28 days. And it varies in individuals from month to month, anywhere from 20 to 45 days. Remember, it's the hormones of the hypothalamus that regulate the pituitary gland. And then the pituitary hormones are going to regulate the ovaries, the HPG, hypothalamus pituitary gonadal axis. But then the ovaries go on to secrete hormones that regulate the uterus. So the ovarian and uterine cycle are very tightly tied together. The ovaries exert feedback over the hypothalamus and pituitary to shut down secretions from the hypothalamus and pituitary in the process of negative feedback. Now the cycle begins with 2 weeks of follicular phase in general, but keep in mind, depending on the length of the cycle, these frameworks may change, which is why it's fairly difficult to tell exactly when a woman is ovulating. For the first 2 weeks of the follicular phase, menstruation occurs for the first 3 to 5 days of the cycle. So the uterus replaces lost tissue by mitosis, and a cohort of new follicles grow. Ovulation usually occurs around day 14. After ovulation, the follicle becomes the corpus luteum, or the yellow body. The second 2 weeks is the luteal phase. This is where the corpus luteum is going to stimulate endometrial secretion and thickening. If pregnancy does not occur, the endometrium breaks down in the last 2 days and menstruation begins, and the cycle starts over. So the ovarian cycle is broken into 3 principal steps. We have the follicular phase here as the follicle grows through primary, secondary, tertiary, and then to a mature follicle. And then we have ovulation following the spike in LH. And then we have the luteal phase, where we have the corpus luteum dominating and its hormone secretions regulating the uterine wall. This whole cycle is showing what happens to the ovaries in relationship to the hormones of the hypothalamus and pituitary. So follicular phase extends from the beginning of menstruation until ovulation. In the average cycle, it's day 1 to day 14. We have a pre-ovulatory phase, which is from the end of menstruation until ovulation. The follicular phase is the most variable part of the cycle, and that's why it's seldom possible to reliably predict the date of ovulation. So there are differing opinions on how many weeks or months it takes for the selected preantral follicle to reach the point of maturity and ovulation. However, in the view we present here, preparation for follicular phase begins almost 2 months earlier. Shortly after ovulation, what we will call cell cycle 1, a new cohort of preantral follicles will descend from the cortex to a deeper place in the ovary. They begin to grow and each develops an antrum. And by late in cycle 2, they've obtained a diameter of about 2 millimeters. At this time, there's a 5-day selection window in which only one of them is selected as the dominant follicle, which will mature and ultimately ovulate in this next cycle. That would be cycle 3. So in cycle 3, then, FSH is stimulating continued growth of the cohort, especially the dominant follicle, because it's upregulated its receptors for FSH and LH as well as estradiol. Therefore, it's increasingly sensitive to the levels of FSH, LH, and estradiol. As it grows, it becomes a mature Graafian follicle, and the others degenerate. So estradiol is going to inhibit the secretion of GnRH by the hypothalamus. The anterior pituitary gland secretes less and less FSH, but an increasing amount of LH. Most of the antral follicles don't have enough receptors for the FSH, so they suffer a reduced FSH level, which is why they will degenerate, while The dominant follicle has more receptors for FSH, and thus its increased sensitivity allows it to prevail. So you can see in this figure here, we have rising FSH levels and then declining FSH levels. And then we can see that LH levels are remaining fairly consistent until about here. We're going to see a little bit of a spike in each of the FSH and LH. So ovulation is the rupture of the mature follicle and the release of its egg and the attendant cells that surround it. This typically occurs around day 14, but again, it's variable. Estradiol is going to stimulate a surge of LH and a lesser spike of FSH by the anterior pituitary. LH is going to induce several events. First of all, the primary oocyte will complete meiosis 1. This produces a secondary oocyte and a first polar body. The follicular fluid builds rapidly and the follicle swells up to about 25 millimeters. It looks like a blister on the ovary surface. The follicular wall has become weakened by the inflammation as well as proteolytic enzymes, and the mature follicle approaches rupture. Ovulation itself only takes about 2 or 3 minutes. A nipple-like stigma appears on the ovary surface over the follicle. It seeps follicular fluid for 1 or 2 minutes, and then the follicle bursts. The remaining fluid oozes out and carries the secondary oocyte, as well as the supporting cells of the cumulus oophorus. It's normally swept up by the ciliary current from the fimbriae and is taken in to the uterine tube. The uterine tube that you can see here, off to the left, is going to capture the ruptured oocyte that you can see here over on the right. The uterine tube is becoming swollen with edema, and its fimbriae envelop and caress the ovary in synchrony with the woman's heartbeat. The cilia are going to create a gentle current in the nearby peritoneal fluid of the tube. Many oocytes are going to fall into the pelvic cavity and die. So because the follicular phase varies in length, the timing of ovulation can be fairly elusive if you're a couple trying to conceive a child or even avoid a pregnancy. And there are a few ways that we can tell when ovulation occurs. First of all, the cervical mucus is going to become thinner and more stretchy, much more lubricated, and that makes sense. An egg's been ovulated, the vagina needs to be more lubricated to receive a penis. You can also measure the resting body temperature. It rises about 0.4 to 0.6 degrees Fahrenheit. It's best measured first thing in the morning and before arising from bed. You record it for several days and see the difference. So women using this method to attempt pregnancy will record the temperature changes over several months, knowing what temperatures coordinated with ovulation. Now, the LH surge that causes ovulation occurs about 24 hours prior to the event, and it can be detected with a home testing kit, just simply a urine test. Some women will also notice Mittelschmerz, a little bit of ovarian pain as the egg busts out of the ovary. It lasts from a few hours to a day or so. The best time for conception is 24 hours after the cervical mucus changes and the basal temperature rises. This is because the egg has had a chance to move enough of a distance down the oviduct to a position where it might meet up with a sperm. So let's take a quick look at the hypothalamus, pituitary, and ovarian axis and its feedback loops. So the maturing follicle is secreting estradiol. The estradiol will act on the hypothalamus and the pituitary to stimulate both GnRH secretions as well as LH and FSH secretions. Now the LH and FSH come down to act on the follicle itself to stimulate ovulation. Particularly LH is important in the process of ovulation. At this point, the oocyte completes meiosis 1 and the follicle enlarges and ovulates the egg. The oocyte then makes its way into the oviduct, where it may or may not meet up with the sperm. That's when we enter luteal phase, or the post-ovulatory phase. If there is no pregnancy, then it'll last from day 15 to the end of the cycle, or 28 days, depending on the length, again, of follicular phase, because that's the most variable. If pregnancy does not occur, the following events happen. When the follicle ruptures, it's going to collapse and bleed into the antrum. This bleeding clots slowly and is absorbed. But the granulosa and thecal cells will multiply and fill in the antral space. A dense bed of capillaries is going to grow all around them. So the ovulated follicle has now become what's called the corpus luteum, or the yellow body. It's named for a yellow lipid that accumulates in the theca interna. The cells are now called lutein cells. The transformation of this ruptured follicle is under the control of luteinizing hormone. LH stimulates the corpus luteum to continue to grow and secrete rising levels of estradiol and progesterone. There's a 10-fold increase in progesterone. This is the most important aspect of luteal phase, high levels of progesterone. And progesterone has a crucial role in preparing the uterus for a possibility of pregnancy. The LH and FSH secretions will decline throughout the rest of the cycle. The high levels of estradiol and progesterone, along with inhibin that's produced by the corpus luteum, will have a negative feedback effect on the pituitary. If pregnancy does not occur, the corpus luteum begins the process of involution, or shrinkage. This begins about day 22, we can see here, or 8 days after ovulation. On day 26, the involution is complete, and the corpus luteum has become an inactive piece of scar tissue called the corpus albicans. It's white now. With diminishing ovarian steroid secretion, FSH levels rise, and that helps ripen a new cohort of follicles. So now the question is, why is it that LH and FSH secretions decline throughout the luteal phase? The answer lies in the high levels of estradiol and progesterone. At high levels, estradiol and progesterone have a negative feedback effect on the hypothalamus and pituitary, thus decreasing GnRH and decreasing the LH and FSH secretion. This is what causes the involution. Usually, one ovary each month ovulates an egg and the other in the alternate month. However, sometimes both ovaries will ovulate in the same month, which can result in twins. With many of the fertility drugs, the objective is to stimulate the process of ovulation. And so often, both ovaries may ovulate more than one egg in a month period when we're using infertility drugs. So the menstrual cycle. The menstrual cycle is highly correlated with the ovarian cycle. It consists of a buildup of the endometrium during most of the sexual cycle, followed by its breakdown and vaginal discharge if there's no pregnancy. It's divided into 4 phases: the proliferative phase, the secretory phase, the premenstrual phase, and the menstrual phase. The first day of noticeable vaginal discharge is defined as day 1 of the sexual cycle. An average menstrual period lasts about 5 days. The proliferative phase is where we have a layer of endometrial tissue, the stratum functionalis, that was lost in the last menstruation being rebuilt. This happens around day 6 through 14. At day 5 of menstruation, the endometrium is only about 0.5 millimeter thick and consists of only the stratum basalis because the stratum functionalis was shed. As a new cohort of follicles develop, they secrete more and more estrogen, and perhaps this is why we need a whole cohort of follicles. The estrogen stimulates mitosis in the stratum basalis, and the prolific regrowth of blood vessels that regenerate the stratum functionalis. By day 14, the stratum functionalis is about 2 to 3 millimeters thick. This figure here shows you the estrogen and progesterone levels, as well as increasing the thickness of the stratum functionalis. Estrogen is also going to stimulate the endometrial cells to produce estrogen receptors. In the secretory phase, the endometrium thickens still more in response to progesterone. So with more progesterone receptors, there's more receptivity to the progesterone that's being produced by the corpus luteum. From days 15 to 26, we'll see secretion and fluid accumulation in the stratum functionalis. So in this phase, we're seeing that the thickness is gained from secretions rather than mitosis. Progesterone is going to stimulate glands in the endometrium to secrete glycogen. These glands go wider and longer, and they become more coiled, you can see here. The endometrium at this point has become about 5 to 6 millimeters thick. It's a soft, wet, nutritious bed available for embryonic development. During the premenstrual phase, there's a period of endometrial degeneration during the last 2 days of the cycle. This is when involution of the corpus luteum is occurring and thus progesterone is falling. As progesterone and estrogen levels form, they stop supporting the growth of the endometrial lining, and we'll see endometrial ischemia, interruption of blood flow, because the falling progesterone levels have also triggered spasmodic contraction of the spiral arteries. This declining blood supply brings about tissue necrosis and menstrual cramps. Pools of blood accumulate in the stratum functionalis, and then it begins to slough off. During the menstrual phase, there's discharge of menstrual fluid, or menses. Again, this fluid consists of not only blood, but serous fluid and chunks of endometrial tissue. The average woman is going to expel about 40 milliliters of blood and about 35 milliliters of serous fluid over a 5-day period. It contains fibrinolysin, which prevents the blood from clotting. So this figure demonstrates the endometrial changes throughout the uterine cycle. Here in the proliferative phase, we just have had division by mitosis. In the secretory phase, we see additional secretion into the stratum functionalis. And then in the menstrual phase, we see the stratum functionalis degenerating. So now we have some material to diagram. The assignment for this chapter will include diagramming and explaining the sexual cycle and paralleling the ovulatory and uterine cycles. So we can use this figure as a guide, as well as this figure of the ovulatory cycle. If you can line up the days and the different events and use bubbles to explain what's going on during each of the phases and each of the points during the phases. You might include all the hormones like FSH, LH, the pituitary's role, the hypothalamus's role, estradiol. We're going to look at follicular phase, ovulatory phase, luteal phase. Then in the menstrual cycle, secretory phase, premenstrual phase, menstrual phase, and the proliferative phase, as well as estrogen and progesterone. Lots of things to include in there, but you can use those figures as your base and add your own little bubbles of explanation, or you can draw out your own. Your choice, but take the time now to review the contents of this past section. And we'll see you shortly for the female sexual response.